The NHS is one of the largest public sector organisations in the country, and we're responsible for 40% of public sector carbon use. The risk for the Trust of not doing anything was very significant. We have to achieve 80% reduction in the next 5 to 6 years, so these projects were really important as a big step change to help us do that.
Supporting the UK's journey to net zero is a core part of Dalkia's DNA. What we do day in, day out, working with our clients, and clearly the NHS is a major public sector organisation and has a key role to play in helping the country on its journey. This is one of the first and biggest decarbonisation projects within the NHS, and as such it's a significant milestone for ourselves, Dalkia, but also for our client, Imperial Healthcare.
The challenges around, in terms of design, I guess, to start off with, is that there are many complex systems of infrastructure. The infrastructure is ageing, and the scale. These hospitals, this is one of the largest trusts in the UK. It was a real challenge at the time, because a lot of the technologies that we're deploying now, that we are designing, were not really considered in the mainstream as such as they are now. There are various plant rooms around the site where it's not been possible to access internally to route heating and cooling piping from the heat pumps to the plant rooms that we need to access. And so we've had to deploy an innovative construction technique where we've gone on the outside of the building to go from one level to the next to facilitate that infrastructure. The principal design philosophies that we've employed is one of modularisation, so the ability to be able to build infrastructure such that it can be easily expandable.
What we have achieved, I think, is huge testament to that collaboration that we've had with our clients and our partners in not only being able to deliver extremely complex retrofit projects that we have done, but in also being able to do that and maintain critical operating live environments for our clients, which is obviously fundamental to the services they provide to their patients at the hospital.
We chose Dalkia off the refit framework. We were looking for an experienced partner that can retrofit a lot of this new technology. The supply chain partner with Dalkia is really important because you need to trust each other. We're doing lots of complex power shutdowns, water shutdowns. Yeah, that level of trust, I think, is the key thing for me.
It's a very kind of collaborative piece that delivers success on retrofit.
As a business, we rely on our people, and it is our people that make these projects a success. So it is really important for us that in delivering these projects, we not only deliver the outcomes in terms of carbon reduction and energy improvements, actually we deliver those benefits for the people who are using the services that we are supporting.
Patients will not really see what the infrastructure that we're delivering is. They will certainly get a range of benefits.
We all experience the NHS outside of business. So I think of all the sectors we work for, it's the most relatable sector. Whether it's us or our loved ones or our family, friends, it's something that you can actually connect with and create that empathy and understand. And I think our record within the NHS as Dalkia is a pretty outstanding record in terms of keeping things going when we're doing complex infrastructure retrofits.
We're partnering with Dalkia again here in Charing Cross for another phase, and also a bigger phase in our Hammersmith Hospital. Certainly I think we're at the forefront of the decarbonisation effort in the NHS.